Okay, good afternoon all. We'll convene this meeting of this is the weekly Commissioners Finance meeting. Today's date, October 5, 2022, appointed hour 1:30 p.m. Having arrived, call meeting to order and begin with an opportunity for any public comment to come before the Board of Commissioners. Do we have anyone online? And we have no one in the audience other than our own county family here. So we'll move on to item 3. We have minutes in hand from our meeting of September 28th as require action.
Move to approve the minutes of September 28, 2022.
I second.
Okay, it's moved and seconded. All in favor indicate by saying aye.
Aye.
Passes. Okay, I'll move us to number 4. Our topic for today of discussion is the multi-state opioid settlement update. We have our own Jack Carroll from Drug and Alcohol with us to provide a PowerPoint and Q&A. The floor is yours.
Thank you. So I have put together some slides based on information that I've received, much of which you probably already know, but there might be some new information in here as well. Although the money has started to flow already from the trust fund that's been established for Pennsylvania, there's still a scarcity of details. And so I'm anxiously awaiting more information. We'll talk about that in a bit. So the settlement, just as a reminder, is a multi-state settlement. Pennsylvania is one of several states that are involved with this. And it's actually 2 settlements within one. The first one is with 3 different opioid distributors. And it's a settlement with a total dollar amount of $21 billion to be paid out over 18 years by these 3, McKesson, Cardinal Health, and AmerisourceBergen. The other part of this settlement is with one opioid manufacturer, Johnson & Johnson, and that settlement is for $5 billion over 9 years. There are other terms of the settlement, but we don't need to be concerned about those for our purposes. Pennsylvania's share of the total amount of money is projected to be $1.07 billion across the 18 years. This includes from both suits, both settlements. And the allocation formula that was used was agreed upon by all the state attorney generals. It's a combination of the percentage of opioid shipments to each state, percentage of population with pain reliever use disorder, the percentage of overdose deaths, and the proportionate amount of population. Pennsylvania's details. Pennsylvania had to set up a trust fund in order to receive the monies, and they've done that. They did that just a couple months ago. The name of the fund is PA Opioid Misuse and Addiction Abatement Trust. There are a total of 13 trustees, 7 of them are county representatives, and 6 are state representatives. As of about 6 weeks ago, 10 of the 13 trustees had been appointed. All 7 of the county trustees and 3 of the 6 state trustees. Because that was a majority, a quorum, the trust was able to move forward and begin its business. Pennsylvania's allocation will be distributed as follows. I think you're probably familiar with this. 70% goes to counties using the same formula as how it was distributed between the states. 15% goes to other municipalities that had their own litigation and agreed to drop that litigation in order to participate in this multi-state settlement. So that includes counties, Cumberland County, and other municipalities In some cases, there were district attorneys that had brought their own suit. And then the final 15%, remaining 15%, goes to the legislature. This is a world of difference from how the tobacco settlement was handled some 20 plus years ago. That money came to Pennsylvania, and it was entirely up to the legislature how to distribute it. It took the legislature about 3 years to come to agreement on that. And in the beginning, 15% was designated for tobacco cessation and prevention. And then the rest went for a lot of other purposes. Across time, though, that 15% has been changed from year to year. It's now down to 4.5%. So counties have seen very little of the tobacco settlement funds. The attorney generals who were involved in this wanted to make sure that the same thing did not happen with the opioid settlement. And so the lion's share.
Not to be pedantic, it's attorneys general.
Attorneys general.
Attorneys general.
Because there's more than one. Okay.
It's not attorney generals, they are
Oh,
attorneys
right.
of a general nature. Attorneys. Sorry.
Very good.
Right.
Good to know. My daughter, who has an English degree, would be happy for that. I think people have seen this chart. This has been shared by the Attorney General's office for several months now. And on here, you can see Cumberland County, they projected 7.2 million across the 18 years. Also relevant for our department, Perry County, 1.6 million across the 18 years. People look at that total number and their eyes kind of pop out. But what I think it's important to remember is that it is across 18 years. So when you break that up, that's an average of 405,000 a year for Cumberland. And for Perry, it's about 89,000 a year. One of the problems that we're going to have with this is that the disbursements are very uneven. They're going to vary from year to year. And to some extent, they're going to be front loaded. There'll be more in the earlier years than in the later years. What we've heard so far from the trust is that once the money is received, they have to be spent within 18 months. That's a little better than the CARES money. If you recall, when we got that, that had to be spent within 9 months, I think it was, by the time the money was received by counties. It's better than, for a number of years now, Pennsylvania and other states have been receiving additional opioid funding because of the ongoing opioid health crisis. And that money has been doled out a year at a time, and with no guarantee that would continue in the following year. And so it's been very hard to plan and in particular build new programming with that funding. This will have a much greater advantage of having a life of 18 years.
Jack, I would assume that it's front loaded because there is ostensibly a, as you say, public health crisis that needs, so we're seeing a bump that we would hopefully see recede as these monies are put to work now.
I have not heard that logic. It might be, that would make some sense. I think part of it might be, if you remember the earlier slide, one of the settlements is across 9 years.
Right.
So all that money is going to be paid out in 9 years. The other one is across 18 years. So I think it might have to do with amounts in the settlement as well. But it really does go up and down year to year. So there's not, we might be giving them too much credit to suggest that it was planned that way.
That would seem to address your concern about the need to build capacity and having the reliability of revenue to build that.
You're right.
But if it's truly up and down, that also undercuts that argument. Okay.
Cumberland County does stand to receive additional funds. And I believe we've already begun to receive the additional funding. About 5 years ago, Commissioner Eichelberg and Commissioner Fleetwood probably remember this. We had some discussions about whether or not Cumberland County should entertain the prospect of pursuing our own litigation. We had a couple meetings about that, met with some attorneys, got a lot of direction from Solicitor Brennan, and the decision was made by the board in January of 2018 to pursue litigation and to secure Hoy Skolnick as the special counsel for that purpose. So as a result, Cumberland County gets a portion of that 15% going to litigating parties, other litigating parties. And there is a projection of that as well.
Can I ask a question related to that as well? I noticed, and I remember these discussions in great detail because there was a lot of discussion about how the liability was being apportioned. And I noticed in your earlier slide about Johnson & Johnson paying a separate settlement, it also notes that they've been out of the opioids business for at least a decade. And I imagine there's a good chance that that's the case because patent expirations, they would probably pass that off to generic manufacturers where there's the margins, they can work on lesser margins. So are there generic manufacturers that have been brought into this other than J&J?
There are, this may be on an upcoming slide. It's noted that while there's one settlement with one manufacturer, the attorneys general are pursuing settlements with 4 additional manufacturers.
Still pursuing those.
Still pursuing.
Okay. All right.
And because of that, there may be additional money, and that might even out the funding in the latter years. Has come on board because I think the plan is to use the same formula for distributing to the states and then within the state distributing to the counties and other parties.
So capture that full.
You may notice that there is no mention of Purdue Pharmaceutical.
Yeah.
And they were probably the most infamous in terms of their marketing practices and the amount of profits they made from the sale of painkillers. And whether there will ever be a settlement with them, it's hard to tell.
So they declared bankruptcy.
They have.
Okay. Are they reorganizing or are they done?
I don't think they're done with that. I think, and the settlement, the discussions of possible settlement are ongoing with them. So there is a prospect of a settlement with them. Yeah.
Okay.
But there's no end in sight to the talks, I guess.
All right. That's kind of where I was going. Is this settlement global or is it? So, okay, that's helpful. I mean, because they especially were very well documented in terms of their internal processes conspiring to.
Yes, and build in incentives for sales. And their strategies. Yes.
Okay. Thank you.
Some key dates. The multi-state settlement became effective back in April. Pennsylvania established its trust by court order in July. The first payment from the national administrator, the national trust, came to Pennsylvania in mid-August, and counties were able to start receiving funds at the end of August. And I believe Cumberland County did receive its first payment.
August 29th or August 31st, whichever was the Wednesday.
So, and they, I will say, I think they made it, I think the trust did a good job of making it easy for county to submit minimal documentation in order to begin receiving those payments. In Cumberland County, the finance office was able to take care of that.
Solicitor Brennan. actually took care of all.
Okay, very good. And a second disbursement of funds is due to come to the counties yet this fall. So that's another dilemma, in my opinion, because we're talking about a settlement across 18 years, but we really get 2 payments in 1 year. And I think the projected number of payments is really only 18. So it's 18 payments across 17 years might be a more accurate way to describe it.
Can you clarify that? 'Cause it was my understanding that as counties completed their paperwork, they would receive their disbursement on a rolling basis. And that payments are continuing through the fall, but it's as counties complete the paperwork.
Well, that is true of the first thing. And the counties were not required by the end of August to submit. But if they wanted money, it was incentive to get the paperwork in quickly. So counties can do that at their own pace and still receive payments throughout the fall. But a second payment is due in the fall.
Can
And
you just send me whatever you received? Because I have not received anything indicating a second disbursement. And
Okay.
so I just want to be able to keep an eye out because I receive the emails and then I alert finance and the treasurer that we have a substantial deposit coming
okay,
so that they're
Sure.
aware. So,
sure, yeah.
sorry for not asking you that last week.
How can the funds be used is part of the settlement. All funds must be used for opioid misuse and addiction remediation or abatement. And there was an exhibit included as part of the settlement agreement that spelled out acceptable uses of the funds. These are some of the core strategies. Expand and support the use of naloxone or Narcan. Expand and support opioid-related treatment, including medication-assisted treatment, treatment screening for pregnant postpartum women and babies who are born with alcohol addiction, narcotic addiction withdrawal syndrome. Expand oral handoff programs and recovery support services, treatment for incarcerated populations, prevention education. All of those should sound familiar because they've all been part of our multi-pronged strategy for over 5 years now. And we have been able to do more of each of that with the additional federal opioid funding. And so none of that is new. The one that we're not involved in is syringe services program. That's something that's being debated by within the legislature right now. And if you recall, I had spoken with you a couple months ago about this and the wishes of our community advisory board to have their name added to a statewide list of organizations supporting the expansion of syringe services programs in Pennsylvania, or at least the opportunity for other parts of the state to get involved in that. At this point, that legislation hasn't moved. So syringe services programs are a strategy that's being used, but primarily in, sort of exclusively in Pittsburgh and Philadelphia at this point. And then data collection and research. They do mention other things, other approved uses. When I look at this, this sounds like a lot like the first line, just different language. Wraparound services, people in treatment and recovery. That fits with one of the new priorities in behavioral health and in our health choices program, and that is recognizing the social determinants of health, other factors that can be an obstacle to somebody's successful recovery from a substance use disorder or enhancing connections to care, treatment and recovery support, specifically for criminal justice involved individuals, harm reduction strategies, opioid-related training for first responders, and planning and coordination. This is a slide about additional pending litigation. There are I'm wrong, 5 other opioid manufacturers. I think I said 4 additional ones. Investigations and negotiations are being pursued with 5 others. And if there are other settlements, presumably the state trust fund will disperse money in the same manner using the same formula. The trust fund has identified an annual process. Payments sent to the governmental entities committed within 1.5 years. Notice the different language in this slide in the Attorney General's office. Not spent, but committed. Used by providers reporting an annual certification. So that's a nice, neat little circular chart that describes an annual process. But we have 18 months to spend the money. So there's still a lack of clarity around if you have 18 months to spend or commit, how do you report it at 12 months? And that's just one of the many details I think the trust fund will need to pay attention to. And that's the next slide. What are some of the unanswered questions? I've already mentioned one. What's the definition of spend? Is it really expended, or is it committed? I'm rooting for the latter because I think that would give us a more reasonable way to even out our commitment funding across time. And that's the next question. How much leeway will counties have in evening out funding commitments from year to year? What will the reporting requirements be? We're told that they won't be as odious as some of the state and federal requirements, but wait and see. And then if there is additional opioid litigation, how will it factor into payments? How will it change that in future years? And all of those questions are going to be up to the state trust fund to answer. I do have some recommendations, solicited or not, for you to consider. The first of those is that my strong recommendation is that you take advantage of our department to carry out the administrative work associated with this. Planning, budgeting, contracting, paying of invoices, monitoring and evaluating and reporting. It's all the stuff we already with the state and federal funding that we receive. And I think we would be the logical body to take care of that, these funds as well. And
you have the capacity to absorb that, or are we looking at additional capacity?
I think we might need some additional capacity. I've had a tentative conversation with Stacy already about even the additional federal funding that we've been receiving has come with additional reporting requirements, and that has stretched our capacity already. So we were already considering the need for some additional administrative support. And to take this on, I think we would need some additional staffing. But there's already a source of funding to cover that. It would not need to rely on general fund monies at all. And a second recommendation is to take advantage of the stakeholder groups that are already there, that are heavily invested in drug and alcohol services. And that includes the Community Advisory Board, who you have appointed. It's our reminder, we have a 15-member Community Advisory Board with 8 appointees from Cumberland County and 7 from Perry County. A second group, for over 5 years now, we've had in Cumberland County, an overdose prevention coalition. And that group continues to meet and has representation from a number of departments that have vested interests: children and youth, probation, jail, court system, but also community recovery support providers, We also have, for over a decade now, a two-county substance abuse prevention coalition made up of volunteers as well. And then, of course, within the county, we have the criminal justice policy team and the human services policy team, both of which have a lot of interest and a lot of shared clients with drug and alcohol. Other recommendations, I think at the start, we would want to prioritize continuing the opioid mitigation program that we started or expanded with the time limit federal funding that we've been receiving. And I'll give you one very good example of that is we started 3 years ago now. No, I'm sorry, 5 years ago now, a Vivitrol program at the prison for folks with opioid use disorder. We got one grant from PCCD, and then we were fortunate to get a second grant. And that grant was supposed to run out a year ago, but because of a couple factors, but the big one being the COVID-19 pandemic and the reduction of prison population. But another factor was that the majority of inmates, once they returned to the community, were eligible for medical assistance. And that was able to cover the cost of the very expensive Vivitrol injections in the community. We had budgeted money in a grant for that, didn't need to use that. We've been able to get now 2 one-year no-cost extensions of that money, but that's going to run out in another year. And it showed positive outcomes, and we want to continue that. I think the settlement funds would be a logical source to continue funding that.
Do we know that those are not going to be renewed in any form?
We don't know that. We don't know what's going to happen with that. The other thing I'll mention with the prison, and you may have heard this from the prison board, is that there's a concern about a recent, I think it was an Americans with Disability lawsuit that determined that if somebody comes to prison and they're already receiving some form of medication-assisted treatment for an opioid use disorder, like methadone or Suboxone, that it's incumbent upon the prison to continue that medication while they're incarcerated. Right now, that doesn't happen for methadone or Suboxone, buprenorphine, unless it's pregnant. And what we've been hearing from CCAP is that county jails are going to have to figure out some way to accommodate that. So that's maybe a new requirement without a new funding stream.
So just unclear. So they come to prison and they're on some form of medical assistance.
Right.
That ends while they're incarcerated,
Yeah.
but then resumes once they are.
Right. Once they're in prison, they used to completely lose their medical assistance.
Yeah.
They did change that law a few years ago, so now it's just suspended, and then it can be reactivated more quickly once they return to the community. That used to be a problem because when they would be discharged, they'd have to apply all over, and that process can be cumbersome.
But for the time they're incarcerated, that burden passes to us.
That
without.
falls on the county. Yeah, unless they ever change that at the federal level, that falls on the county, or if it's a state prison,
Okay.
the state.
As soon as they fix the elections, they'll get to that.
Okay, so that's another thing that we may need to look at for this opioid settlement fund. We've expanded drug and alcohol treatment overall, particularly medication-assisted treatment, not just in the prison, but in the community as well. And we could expand it even more. But again, I have been hesitant to greatly expand when I don't know that there's continued funding out there. Because I know that one of the questions that you guys will ask me if I pursue more grant money is, all right, Jack, how are you going to pay for this when the grant runs out. Up until now, I haven't had a good answer for that. But now I think we do have a good answer. Strengthen case management and recovery support services. We've been doing some of that. We could do even more. Strengthen the problem-solving courts. I do have a standing request from Judge Brubaker to increase drug and alcohol case management support to two problem-solving courts that she oversees. The Palms Mental Health Court and the Overdose Intervention Court. Continue widespread community education and distribution of naloxone. Continue to expand evidence-based prevention programming in schools. This is an interesting one because we have been promoting our prevention unit, evidence-based programming in schools for probably 7 or 8 years now. And it's a tough sell because to meet the standards to be evidence-based, there has to be a significant commitment of classroom time, of instruction time. And meanwhile, schools are getting bombarded with, these are your test scores. They're not so good. You need to get those up. So it's very difficult to get significant commitment. But across time, we've done that. And we've reached the point now where it's been very hard for we have a relatively small prevention, 3 staff serving the Cumberland County schools. We have a contracted provider for the 4 school districts in Perry County. And now we're getting to the point where it's hard to keep up with requests that are coming in. We are, when possible, trying to convince the teacher to, why don't we train you to implement this yourself? And in some cases, they're taking us up on that, using a training of trainers model. But in other cases, they're not able or not allowed to. And I think I've already mentioned this. I think we need to develop a strategy to ensure relatively even funding levels from year to year, at least in the early years of this. So my argument would be that we come up with an annual budget and we don't deviate a great deal from that, either go above or beyond, below that by too much. So, and now I understand we would need to get the trust funds approval to be, because that could involve setting some funds aside for future years so that we can have that evenness across time.
Because that 18-month, is that the main problem for that 18-month spend requirement?
Yes.
Okay. Yes,
that's the main problem with that. And I think they're proud of that because it's more than a year. and everybody's been complaining.
That's long-term thinking.
All this money you get us, you have to use it within a year, and that's hard to do. That's hard to do that in an effective and in a responsible way.
Only other question I had, it's not there anymore, but you mentioned about the schools. I'm assuming is that just public schools?
No, we work with private schools
Okay.
as well. Yeah, we work with anybody who's interested. We're happy to learn that. I think we've been doing student assistance now for over 35 years. We started in the mid-'80s, and for the first time this year, Trinity High School is going to have a student assistance team, and we'll have a staff member serving as a liaison to their team. So that's good. I went to a Catholic high school. I can tell you that there is some drinking that occurs and some drug use that occurs among Catholic students. So that's all I'll say about that. That's all I'll say about that.
That's very helpful.
Questions or comments?
A really good start to me. So it'll be interesting.
We have been approached already by maybe a half dozen different organizations, some very small, some large hospital systems that have said, hey, you're getting opioid money. We have some great ideas of how that could be used.
We know the feeling, okay?
Well, I think some of those actually came to you and you passed on to us. So, yeah. And what I've been telling them is that it'll be a while yet until we set up a process, a planning process, or figuring out how to use those.
Are you, in this, maybe you mentioned it, I missed it, but how much of the service provision is going to be county employees versus contracts with vendors?
Most of it would be contracts with
Most of
vendors.
vendors.
We have our department right now. Well, when we're fully staffed, I think we have 21.
Okay.
And most of that is some form of direct service, case management, student assistance, or prevention. But all of the treatment services and all the recovery support services are purchased from private service provider agencies.
So is the capacity there? Because as you know, we're running into a lot of capacity issues in other human service areas. It's just not, vendors exist, but they don't have staff either.
Yeah, that's a great question. I can't say with certainty that it is, but if they have contracts and they have funding streams, then at least they have the resources to go out and expand staff. But that is an ongoing challenge for all of our. I was delighted. One nice serendipitous thing that happened. I went to the Tom's Court graduation this morning, and afterwards, a young woman came up and said, "I'm a mental health case manager, but I'd love to get in the drug and alcohol field." I'm thinking, don't let Annie see me. Give me your email. I'll give you the list of our providers because virtually all of them are looking for additional staff.
Yeah.
She claimed that since she was in 7th grade, she wanted to work in drug and alcohol.
Well,
I believe that's true because there are a lot of folks, but then there's a lot of folks in our field that that's not what they planned on being when they grew up.
well,
I have yet to meet with the Perry County Commissioners, but I do have meetings scheduled with them for Friday morning. Basically go over the same slides.
That's good.
Anything else?
Certainly, all of these things are making a difference.
They are, and I'll give a little bit of good news because usually I share our overdose death stats and it's bad news. It's always bad news. But we hit our peak in 2017 and we started around the same time that we were looking at litigation. And we implemented a number of efforts and we had a significant impact in seeing a downward decline in overdose fatalities in Cumberland County in 18 and 19. Then the pandemic hit, everything shut down, and it spiked up again in 2020. In 2021, it was reduced somewhat. 2022, it was reduced some more. Well, in 2022, the numbers so far show that it will be a further reduction. So we'll be back to where we were maybe in 2015, 2016. If the trend continues, that's always a big one. It doesn't take much. And fentanyl, as I'm sure you know, is showing up in everything. It's no longer just heroin. It's in cocaine, it's methamphetamine, and we have these counterfeit pills now that are very colorful. And that's our latest concern. They could be mistaken for sweet tarts. It's accidentally common. Thank you very much, Commissioners.
Thank you.
Okay, that moves us to item 5, other districts. Do you have anything additional coming from the group?
Yeah, I did bring up the item 5A. I would like to request that for our Board of Commissioners meeting, not the workshop, but our regular meeting, that under the salary board section, where it mentions salary board actions, that we actually list those items more or less like we do with contracts or existing in our new contracts. I checked with our solicitor today, and he said that would be fine. So that is my request.
I'm fine with that. It seems like a good idea. Oftentimes, we're always voting on those salary board actions. And we vote on them as a group. And no one knows what we're voting on. And the same thing happens with those personnel actions. And I don't know, I would be interested in knowing the same thing about personnel actions. Can we spell them out? Can we set them up like contracts and grants? Or do we need to, is there a reason why they're not like that? I'm interested in the why of that.
Okay. I will tell you that the timing is interesting. Last week, Lisa Grayson actually reached out and provided an example of Lancaster County and how they present salary board. I thanked her and told her that I would have a conversation with Holly. And we were actually slated to discuss it on this Friday. So I can certainly include getting some answers to the questions that have just been posed as well.
It's unclear because the attachments as part of the packet provide a fair level of detail.
It's part of the commissioner's packet. It is not part of the regular meeting packet.
Okay.
And it's not posted. So when the agendas are posted, it is just the agenda.
Got it.
That is posted. Some of the personnel actions, we certainly would not be able to list.
Correct.
Obviously, they're personnel matters, but we can certainly, Holly and I will discuss it and kind of bring you back some answers to those questions and some possible format changes to.
And I would be interested in this also, because as I start to think this through, the thinking goes in two different directions. But if there's a package of salary board actions, and there are no votes to those salary board actions, some of those salary board actions directly affect the personnel actions. So if the vote is no on salary board, but the vote is yes on personnel, what does that mean? I'm interested in that interplay. Okay. But people certainly deserve to know what we're voting on, what we're voting against. And I think, when we do our contracts and grants, right, if there's a no vote on a contract and grant, we pull it out. And I think what that does is it alleviates the issue of possibly voting no on everything. And so I would certainly like the freedom in the future to be able to pull out something that I want to vote no on, or yes on, or whatever, whichever way it's going.
Yeah, I know Angela is working on updating the format so that the capital projects would be lettered in the same manner that contracts are lettered. And we could certainly look at lettering those. That would make it easy to designate if one needed to be pulled out.
Yeah, I think that would be good.
That's all I have.
Okay, if there's nothing else. For adjournment?
Move to adjourn.